anytime you're working with a patient, I mean, I think it has to be a partnership to find what's right for them, find the solution that's right for them. And I don't think this is the kind of medical office where someone walks in, slaps up an x-ray, and gives you a recommendation and walks out. I mean, our job really is to find out what your needs are, what your concerns are, what your priorities are.
We have neurosurgery spine, we have orthopedic surgery spine, and we have physical medicine and rehab spine physicians who are all really focused on the same thing, and that is to get relief of a patient's symptoms with the most minimal treatment that we can prescribe.
I think patients need to know that when they come in to the Seton Spine and Scoliosis Center, from the very first person that meets them at the front door, to the reception, to the medical assistants, to the physicians, and on their way out, I think they'll really see that we are in this together.
I had shrunk to about 5'2", and I was 5'4", and I shrunk to 5'2", with big things sticking out. And he said that they would put in 2 rods, and there are 11 vertebrae that have 2 screws in them each, so there's 22 screws in there. Toward the end, it was getting painful. I'd have to, not painful all the time, but I didn't have the stamina that I do now. I've made it a point to be active and to stay active by doing the exercise regimen that I do, and going to line dancing, and mentoring and teaching and doing the different things that I do, because you know, if you go through this, you don't want to get old too quickly.
On a scale of 1 to 10, I would call it a 12. It was something that I couldn't do anything. I couldn't really walk or stand or sit. Laying down was the best relief, but it wasn't total. And I was lucky in that we started, this started Christmas morning. Something didn't feel right, and it just escalated.
The newer technology that we can use sometimes for that particular condition involves the use of an endoscope, or a camera that we insert via a small incision near the spine, and it allows us to visualize the nerve and the disc, remove the piece of diseased disc, get the pressure off of the nerve. It involves less dissection of the muscle around the spinal column, and people tend to have a little less pain post-op, and since there's a smaller incision, less disruption to the soft tissue, people tend to recover faster and get back to their routine faster.
This side of my back used to stick out several inches further than this side, so if I was just standing straight, you could see the difference of, you know, how the back stuck out further, and my shoulders were unlevel as well. The pain just started getting worse daily. It just kept progressing over the days and weeks, and finally my husband was like, "We're not doing this. So he did his research on the internet, and that's how we pretty much found Dr. Geck. So. 6 months, I think I started jogging a little bit, but mainly just walking. And then after a year, I was back to running like I'm used to doing, and doing full-blown boot camps. So, which consisted of carrying logs, pulling tires, push-ups, sit-ups.
Now we're trying within the center to bring it all together, to bring the neurosurgical perspective, the orthopedic spine perspective, and the rehab perspective all together in the same place. So whether we're talking about someone with 2 weeks of back pain, we're talking about a herniated disc that Dr. Stokes is going to take out through a 4-millimeter endoscopic incision, or whether we're talking about the biggest, most complex spinal deformity or tethered cord or spinal tumor that may even necessitate an orthopedic and neurosurgical team, that's all here for the folks in Central Texas.
The difference here is that the three of us are on the same page. We are here to attempt to restore function and achieve those goals, preferably with non-surgical means.
You have a spinal problem, you come here, you get it treated. Yes, you may be referred out for physical therapy, but that's really one of the only things that we refer people out for. The injections are done here. Physical therapy programs are certainly recommended here and supervised. Surgical procedures are done here within the network and family of hospitals. And basically we can handle any spine problem that there is.